better sleep, sharper focus, a healthier life. It all starts with how you breathe.
Welcome to the No One Told Me, the Airway Health Connection, the Untethered Way, where better breathing meets better living. I'm Dr. Meggie Graham.
I'm Dr. Liz Turner.
We're the co-founders of Untethered Airway Health Center,
on a mission to help you breathe freely and live fully through proactive airway health.
Whether you're a dentist expanding your airway expertise
or a family looking to sleep and breathe easier,
you're in the right place.
Each week, we'll bring you bold insights, real-world stories, and expert tips.
All to help you take control of your airway health. Because when you breathe better, you live better. Let's get started.
Well, welcome everybody to No One Told Me, the Untethered podcast about airway health and really about people's journeys. I am Dr. Meggie Graham, and I love doing these because I learn something every single time, and it's become a way for me to hang out with my friends virtually. Today, we're joined by Dr. Katie Johnson. She is a general restorative practice dentist and practices in Denver, Colorado. She focuses on airway health and joint health. And she also is a patient herself. And she and I were recently talking about her journey. And I, of course, went straight to, oh my gosh, I wish I was recording this. And you come on my podcast and share it with our listeners. And so she graciously has given us our time today to chat. So welcome, Katie. Thank you for being here.
Thank you. I'm excited to be here.
I was kind of hoping you were going to show up with sweet Sophia. She's got the cutest little babe that I'm a little bit obsessed with. So tell me about, one of the things I love about this journey so far and this path and this specific field of dentistry is the people that we meet tend to become really passionate when something becomes personal. I think by default as dentists are prevention-based providers, or we learn that we want to help people. But once you're kind of bitten by that personal connection, it's like you can't look back, and your path forward, not only as the patient yourself, but as the provider, is unwavering. So tell us a little bit about your story and tell us about your story and how you got to where you are today.
Yeah, for sure. And to your point, like once you see it, you can't unsee it. So it totally changes the passion. My story is interesting because at age 36, I went through jaw surgery, and I'd been told growing up by my orthodontist that I needed jaw surgery, but it was only strictly for a gummy smile. And so, it was probably around my 20s that I really started to notice some of my symptoms. That's when my tonsils came out. I think I was 19 actually. I was a freshman in college. Not a fun thing to do when you're in college. But my tonsils came out. I had sinus surgery. I was dealing with all of these things that I realized now had been compounding my whole life. And, Dr. Jeff Rouse, who I refer to as the godfather of airway, it wasn't until I met him that I really started to understand that so much of what I've been experiencing my entire life was related to airway. So even, at the age of 6 months, I look at pictures and I can see the little allergic shiners, underneath the eye. And I can see my poor little red nose from always rubbing it. And I was the kid that, funny enough, I used to get in trouble for chewing with my mouth open because that was a thing. But I now know I couldn't breathe, right? I went to PT to learn how to stand up straight because my mom couldn't understand why I was standing the way that I was. Yeah. Oh yeah. All sorts of stuff. Right. And, so I heard Jeff speak, and he started talking about asthma, and he started talking about acid reflux. And that was the first time I realized that so many other symptoms I was experiencing could very much be connected. And so it was after, the first seminar that he gave down at Spear that I ran into him at the bar after, and I asked him, I said, Jeff, what do I need to do? I had no idea at that point. I just knew I needed help. And he said, we got to fly to Texas. So I flew to San Antonio and I saw him. And that's when we really dove in and we looked through a lot of my history. We looked at everything, the long story short is my skeleton didn't grow correctly. It was too small. Everything was too small. And so he basically said to me, well, do you want to try some things or do you want to do jaw surgery? And at that point, I think the advantage of being a dentist is you really understand some of these things and you understand what goes into it. And I said, well, obviously I want to be fixed. And so age 36 is when I had jaw surgery out in California. And I think the biggest thing for me post surgery with all of that was, and you and I were talking about this earlier, is that first breath in the hospital, like, holy cow, you have no idea. I mean, I'm sitting there with my little suction, and I'm like, this is what it feels like to breathe. Like, it's the most like euphoric experience. And to this day, just going back to that feeling, I think is that like I would do it again. I hate to say this, but 10 times over because that change was such a huge thing for me. And um, I talk to my patients about this a lot too, because obviously I have that personal side of it now. And I always tell them I never know how much better somebody may or may not be, but even just a fraction of, improvement is such a huge thing anytime you can improve yourself. So, anyways, that's kind of long and short of it, and we can obviously talk more as we go.
I love it. I love that you bring up the fact that you noticed your first breath after surgery because I was talking actually today about this with a dear friend of mine who also went through jaw surgery in her 30s. For her, the tipping point was after having a tooth break because her occlusion was wrong, only her back teeth touched, and she just hated the process of having dental work done. And, she had a couple of things that made it even harder to have dental work done. One, she couldn't breathe. We're in the back of her
Mhm.
mouth. So that tooth had been getting a lot of trauma from a poor bite her whole life. And she got done with that crown. And she's like, I know you keep asking me about doing orthodontic treatment. And I know that when I was younger, my orthodontist told me that, jaw surgery was an option, but it was not something that was interesting to me or my parents because none of us knew that I was actually problematic
Yeah.
or suffering. And she said, I remember when I woke up from actually the aha moment for her, she said, was being asked pre-surgery as that crown was a tipping point to not wanting to go through more suffering, not wanting to go through more dental work. But the aha moment for her realization was when the questions went from how do you breathe? How do you sleep? Fine, fine, fine. Somebody asked her along the way, and I wish it was me, but I'm going to change the way I speak to patients now because of this answer, was, do you have to sleep in an altered position? And she's like, well, yeah, I sleep on my right side with my chin up.
Hmm.
And she's like, that moment, when I answered that question so quickly and definitively, I realized, oh, I never thought that was weird. Then she went through the jaw surgery and she woke up and like you, the first thing that she noticed was, this is what it's like to breathe.
Yeah.
And
Yeah.
that's such an amazing concept that people are going into their adulthood unknowingly suffering, unaware that they can't breathe until it's given back to them because we're so good at figuring it out and compensating and getting it done,
Yes.
even pathologically, that we don't know it's bad.
Hmm. For sure.
How how does that change the way that you speak to patients? Because it's easy for me to say, do the jaw surgery because we know as dentists all of the intervention that's necessary if you say no to this intervention. We know that it's not just a clean, easy path forward. But for the patient that doesn't know that they're suffering, it's a
Hmm.
hard yes because it's a huge time commitment, investment, recovery, a surgery. And so to say yes to that without knowing that you're suffering is hard. What do you say to help people connect the dots?
I mean, I think that's where it becomes very individualized, right? So you have to really connect with your patients and figure out what their driver is. So, to your point, your friend, she didn't want to have dentistry. For me, it was my tipping point. Well, one of them was the chronic weight gain that I was experiencing in my 30s that just wouldn't stop, and there was no reason why, in my head, why that was happening. I
Attributed
now
to
know.
poor sleep.
Yeah, exactly. For other patients of mine, gosh, I have one patient who like insomnia was his thing, and he's like, I just want to be able to go to bed and actually sleep more than like 2 hours and and I'm like, yes. I mean, I think it's different for everybody. And so it's the matter of, at least for me, when I talk to my patients, I don't go in first and be like, you need jaw surgery, right? Because that's a really overwhelming thing unless they're coming in to have that conversation. But sometimes when I talk to them, I'll just say, hey, you know, we've been talking about these things and you brought up you had asthma as a kid and you weren't able to breastfeed or whatever it might be, right? We have these conversations and I'm like, there's some really great things that we can do about that. And patients that have been thinking about it or find um gosh, they've been thinking about it or they're aware that something's not right, they'll say, "Well, what are those?" And that's when I can say, "Well, your options can range from, you know, orthodontics or MARPE or restorative dentistry all the way up to jaw surgery." And some of them look at me like I'm crazy and I'm like, "Well, believe it or not, sometimes surgery is the most like conservative thing we can do." And the longer we wait to do these things, the harder it becomes to be healthier, right? So it's like for me, I had 36 years before that surgery that I had to start unwinding that stuff. It's never going to come all the way back, right? But I know I'm healthier now than what I was then. It's the same thing for other patients. And some of them bite off, some of them need to think about it for a while. Some of them, it's 5 years later and they're like, "Tell me about that again."
Well, and I think that, I think that's just a great point, like planting seeds.
Hmm.
And anyone that knows me knows that I don't have a really gentle touch. I come in guns a-blazing and ready to save the world, even if you don't know that you need to be saved.
Yeah.
And I'm softening and I'm learning, but I think that
Yeah.
I close the door, I slam the door on the possibility of more intervention because I came in before the patient was ready. And
Mhm.
it's because we care and it's because we know that there's a different way out there. But if the patient can't connect there or get there personally, it doesn't matter what we know and it doesn't matter what the
Right.
treatment options are. They have to need to want to do something. Um,
Correct.
Jeff says you got to let some of them die. Gary or John Coy says you can't care more than the patient. You can't offer
Right.
treatment to somebody that doesn't know that they need treatment. There's all these
Right.
little adages, but like it really is important to understand for providers that are listening. We can plant seeds, but they're only going to be seeds that will grow if we connect on a personal level and know what's important to them.
Mhm.
I think
Right.
that's
We need
such
we
a
need patient buy-in. They have to be, it's kind of like if you've ever done aesthetic work on a patient that didn't really want it, but you kind of twisted their arm, they're the ones that are always back in your chair because they want this corner changed or they don't like the way it looks. But you get that patient that just wants to have a beautiful smile and they came in for that, they're so happy. And you never see them unless it's for a hygiene visit because they're just thrilled, right? So if you don't have that buy-in, the last thing you want to do is kind of force somebody down a path.
well, and I think that I mean, zooming way out, I'm sure this is very analogous with other professions and other niches, but with dentistry, dentists have a pretty bad rap, right? Like a pretty bad stereotype. People don't like to go to the dentist. They cause pain, they're expensive, they don't know if
Hmm.
they trust them. And I
Hmm.
think part of that comes from, not all of it, but it comes from being told that you have a need that you don't quite understand. And we
Hmm.
are not taught, or at least I wasn't taught during dental school, how to sit knee to knee with somebody and co-diagnose and have them understand what's going on in their mouth. Even as a dentist, it's really
Yeah.
hard for me to orient myself in my own mouth. Like where am I? Like people don't
Hmm.
know. So
Hmm.
I think that what you're giving to them as a provider is such a gift because you're giving them the opportunity to know that there are options and you're giving them the opportunity to say yes to a different path. I
Hmm.
also think that we are trained to think that not giving big interventions is a favor to people. And what you said earlier made me think of this. You would do it 10 times over again.
Yep, I would.
How many times do we hear people say, well, I don't want to have my jaw broken. I don't want to break my
Right.
jaw.
Right.
And if that's the way that providers are talking to patients, nobody in their right mind is going to say, well, yeah, I want my jaw broken.
Right.
We have a responsibility to present information objectively and in a way that helps patients see the possibility. And if you're
Hmm.
an oral surgeon and you don't like jaw surgery, that's fine. You don't need to be the one doing it. But to say, oh, you don't want oral surgery, you don't want orthodontic
Correct.
surgery, that's so barbaric,
Yep.
that's so irresponsible. And it's actually doing harm to a lot of
Hmm.
people.
Hmm. 100%. And I think, unfortunately, that tends to be the common response, especially from providers that aren't comfortable either talking about it or doing the procedure, right? Like I hear it from a
Right.
lot of ENTs too. And I'm like, but you don't know. And in the right hands, man, it could be done really well. And it could be, I mean, of course, I don't want to minimize surgery. It's a big deal,
Correct.
but done in the right way and done, with a consistent protocol, you know, you go through the motions and you heal and you get better. And man, the other side is really amazing. So, and that's what I tell people. Like, surgery's hard. Surgery is always hard. Also, living sick is really hard, right? And what happens when you, this is another thing I tell my patients, what happens when you become 60 or 65 and you're, postmenopausal, right? And your heart risk goes up. Like, what's harder, going through jaw surgery and getting yourself healthier so you're sleeping better, or developing sleep apnea later in life and having a heart attack or a stroke, right? I mean, the reality of it is that. And so when I talk to a lot of my patients, especially younger ones, it's like, well, I understand that this sounds like a really big deal. And sometimes consequences of not doing something can be a whole lot worse. And we don't know.
Right.
And that's the hard part. We don't know.
And then if, for some patients, many patients, let's say it's presented to them in a really objective way and why it might be beneficial,
Hmm.
it might not be accessible. It might not be
Hmm.
accessible in your area. Maybe you don't have the
Yep.
means or the ability to travel. You don't have the financial capabilities to do it. Then, okay, well, here's the gold standard and here's the best
Yeah.
option. That doesn't mean do nothing. Here are
Right.
choices A, B, C, and
Yep.
D. Start to chip away at the issue. I always say tip the needle towards health is
Yes.
still in your best interest, even if you don't get all the way there.
Even little changes can make such a big difference. Choosing to just ignore or do nothing, that's when I mean, we just don't know what will happen. But choosing to make little changes that make yourself healthier, absolutely, anytime.
So it's changed you as a patient. You're healthier. You
Hmm.
didn't know you couldn't
Hmm.
breathe, and now you're sleeping well and you're feeling better, and your health is, changed for the better.
For
You told us
sure.
how you changed as a provider, really connecting and understanding their why and how to help support them to
Mhm.
make a decision. How has it changed you as a mom?
Well, I will say one of the biggest reasons why I wanted to do jaw surgery, because I knew I needed to be healthier, was to be able to be pregnant. I didn't know what that was going to look like if I wasn't a healthier person. So I truly, I mean, I can't say for sure, but I truly think being able to breathe better and sleep better made my pregnancy much healthier than what it would have been had I not done this. Um, I also think for me, because I am sleeping better and because the sleep I do get is quality sleep. So yes, I have an 18-month-old. Sometimes certain nights are a little rough, but the sleep that I get is quality sleep. And so I can tell my brain is brighter, right? Like I don't have the brain fog I used to have. I feel like I can be more engaged with her. I'm definitely a more patient person than I was pre-surgery. Um, there's just a lot of things that I can just tell. My body is regulated a lot better than what it used to be. And so, I think I'd like to think that makes me a better mom too.
What about from the perspective of seeing her growth and development?
Oh yeah, for sure. Well, she is my kid. So
She's your spitting image. Oh my gosh, she's
yeah,
so sweet.
she is my kid. I am so incredibly grateful to be able to understand, gosh, growth and development now and a lot of the things that we just didn't know when I was growing up. So she has little jaws just like I do, but she had her first release, her tongue tie release, and buccal ties and lip tie at 3 weeks. We did a second round at 3 months, and holy smokes, did that change so many things for her.
What did it
She
change?
so, breastfeeding was never really an issue. That actually went okay, but she would get really tired. So, her ability like to feed longer, that was like the initial big change. And then growth of her lower jaw has significantly changed. So, initially she was pretty retrognathic, and now she's got a great little facial profile. So, that's huge. I watch her eat dinner and she chews with her lips closed, which is like some sort of miracle. It's amazing. She breathes through her nose at night. So I see all these things and I know she's got expansion in her future. Who knows? She may even have jaw surgery in her future, but the changes that we've seen already with just some minimal procedures, it's a game changer. I mean, it really is a game changer.
Well, and I think that that's an important point to touch on too, is now back to being providers. I think there's
Mhm.
a responsibility to offer help to patients, but also remind them that it's a journey. So
Yeah.
often we'll see patients at Untethered that will come in and say, well, they had a tongue tie release when they're infants. Why do they need expansion now? Not one of these treatment modalities is a magic bullet that is going to
Mhm.
save you from all
Mhm.
other future interventions.
Mhm.
And it doesn't mean, because there's no guarantee that future intervention isn't going to be helpful, doesn't mean you shouldn't do the intervention now, because each step
Right.
along the way is
Yep.
going to offer better health, better
Mhm.
breathing, better sleep, better growth. And it might not be perfect, but it's better. And
For
then
sure.
you keep checking in. Okay, what's on our plate now? What options do we have? And then the families have this option to make the decision. Does it warrant it? Does the intervention now serve us? And they might
Mhm.
choose not to do anything, but if the suffering outweighs what they could go through,
Mhm.
it's an important thing to mention. And to say that, yeah, we can do all these things and you might still need jaw surgery, but you're going to go into jaw surgery a heck of a lot healthier and with a lot less suffering if we
Yep.
can continue to tip that needle.
Yep. 100%. And I like to think of it as like cumulative, right? Each of these little steps adds up to be these greater things. And so, unfortunately, the way that our skeletons grow these days, there is no perfect human anymore. So anything that we can do to try to correct some of these less than ideal uh, growth patterns, as our children are growing or as anybody's growing, I think it's huge. And it is, we do know that even tiny changes can make a huge benefit. And I look back at me and I see some of these things. I had a tongue tie and it was totally missed. And my mom's a speech pathologist and she, it just wasn't something that was being looked at that time. And so to be able to live in a time now where we can recognize these things and we can help with just the tiniest little changes sometimes in these little humans, it's incredible.
This weekend we had the advanced frenectomy protocol in Denver at Untethered, and one of the questions that came up is still kind of swirling in my head. It was a dentist that said, I'm hesitant to offer frenectomies because there's such a outcry that these should never be done.
Mm,
And I think that there's such a misunderstanding of what is
mhm.
ankyloglossia, what is a tongue tie, what is normal
Yeah.
anatomy, what is a frenum. Why would we care to intervene when Sophia had no problems breastfeeding,
Mhm.
or major
Yeah.
problems breastfeeding,
Right.
or there's no obvious speech issues? And I
Hmm.
think that the point, if let's say we can get past what is and isn't a tongue tie, let's just assume that everyone understands that diagnosis, which they don't. Um, if you get to the point of now whether or not to treat, there's so much that goes into the growth of the face that comes from optimal
Hmm.
facial muscle movement that people don't
Yes.
understand. We can
Yes.
learn to breastfeed compensatorily. We can learn to use the wrong muscles to speak, but that will come at the cost of how the jawbones grow. And
Hmm.
of course, there is that genetic component that you alluded to, but if we can help the functional part of it, there
Yeah,
is a reason to do it.
for sure. 100%. And, kind of like we were talking about before, especially if you're seeing a well-trained clinician for these things, like there's a good conversation that can happen. I wouldn't just go see somebody that decided one day, hey, I'm just going to do this, right? Like the people that you guys are training and the education that you're creating, I mean, it's incredible and there's so much value in that. And I mean, yeah, it's hard to put a few-week-old baby through a procedure and holy cow, it's amazing what it's done. And she doesn't remember. She doesn't. I
Yeah.
mean,
It's it's hard as the mom. It's easy
yeah.
as the provider to give treatment recommendations and to do treatment. And then when it's your own child or your own
Mhm.
family, it's so much harder to make those decisions. And yet
Mhm.
still we would do it again and again. Um,
100%.
I think that another thing that providers can do for their patients, even if you choose not to offer different treatment services in your office, is educating the patients of the connection so that when they are out there interviewing providers, which you get to do
Mm-hmm.
as patients, you get to interview providers. You don't have to
Yes.
go with
Right.
whoever you think you have to go with. People travel for this, they seek them out. And red flags to look for is all or none, black and white.
Mm-hmm.
Oh, tongue ties are never an issue. All frenum need to be treated.
Mm-hmm.
Um, let's just clip and go. Let's just do it right now. Like having somebody that is able to zoom out and see the interconnectedness of all of it is probably the sign of a provider that you want to be working with, because we learn in isolation and different body parts or different techniques or different tools, but the whole body functions together. I always say the body's going to body whether or not we know it. So these are things that if you're listening and you're a patient, these are things to consider when you're looking for a provider. Do they understand how it all connects? Are they comfortable saying, I don't know? Because if they can say, I don't know, that's a sign that they're willing to learn and continue to grow. Somebody that says all or none or yes or no without scientific backing and just, I think that they can slam doors the same way an overly excited provider can close doors too.
Yeah. Yeah, for sure. For sure. 100%. And I think to add to that, like, I don't perform all these procedures in my office, but I've worked really hard to build a network of people that I trust. And sometimes that may be sending a patient to one or two different people so that they can interview them, right? Because it is important to feel comfortable with whoever you see. But I always want to know that I've got a solid network of people that I can say, hey, you know what? I don't do that. This person does it really well. Because I've always believed that if you're a jack of all trades, you're a master of none, and that's just not how I work. But I'm happy to share my knowledge and help explain things so that people have a better understanding, so that when they go to those appointments, they know the questions to ask, right?
And that's such a service, right? It's such a service. And then also you get to then, let's say they follow through with recommendations and they have jaw surgery, or let's say they need an expander or anything like that. Let's say they need restorative work. Now you as a restorative dentist get to do restorative work in a much more predictable environment, and it's so much more fun, and the patient gets a better outcome. And from a mental health perspective, you don't have to start doing treatment that you're not interested in doing. You just get to quarterback.
Right. Yeah. It's really great to have like an awesome team of people to work with.
It is. It's so fun. It's so rewarding. I love it.
No, I think the only thing that I would say is, to the dentist listening, just be curious. And if there's something that we've talked about that you want to learn more about, do it. Like what you learn in dental school is not so much of the big picture now. And holy cow, is it fun to learn how things are connected. And you can help so many people in so many different ways. So I really think, just be curious in life. And to patients too, ask questions. If you feel like something's not right, either with your child or with you, ask questions. And if you don't get an answer that you like or that you feel like makes sense, then keep asking until it does make sense. Because I think that's kind of where we're at. And there are people like us that can have these conversations, and there are more all the time, but it's not always the case. So just ask questions.
It is fun to see that there are more and more people that are thinking outside of what we learned in grad school and residencies. Thank you for taking the time to share your story.
Yeah.
It's just such a beautiful story, and I love the outcome, and I love to hear that you would do it again and again. And I'm so happy that you're healthier and feeling good.
Yeah,
it's such a gift to your patients. I sure love you, and I love that I got to see you today.
So good to see you.
All right. Thanks for being here, and thanks for listening, everyone. Check out our other podcast episodes. We did go into some specifics on health and breathing during pregnancy a few months ago that I thought of today when Katie mentioned that. And if you have any topics you want us to hit, by all means, reach out. Let us know who you want us to interview and what you want us to talk about. Awesome. Have a great day. Thanks.
Yeah, thank you.
Thanks for tuning in to the Untethered Airway podcast.
If today's episode helped you see things differently,
Please share it with someone who would benefit from hearing this. And don't forget to subscribe.
want to learn more about Airway Health or connect with our team?
Please visit our website, untetheredairwayhealthcenter.com, or follow us on Instagram @untetheredairway.
Until next time, bye.